101.7 The Truth, Tory Lowe Show. We got Sequanna Taylor, Assembly District 11, in studio.
Yeah.
Look, straight from the Assembly up in Madison.
Yeah, well, not today in Madison, but running around. But absolutely.
But I appreciate you for coming through because I seen you at the celebrity basketball game.
Yes.
And I'm like, hey, what's up, my girl?
I know.
Come on now.
I was coming.
I know. I knew you. Like I said, we was gonna have. I need to have these conversations on the SNAP benefits.
Yes.
You know, folks up there, you know, they wondering when the first of the month come, what's gonna happen?
Yeah. To be honest, and I can't share it publicly, but I've already received some copies of people letters that's saying, hey, come November 1st, your food share is already delayed, right? So they've already received that update for some people within my district. And I have, and I'm not giving out the numbers now, but I will put out some later. I have like one of the highest amount of individuals who receive SNAP, right? And so
in your district?
In my district, District 11. So believe me, I am working with some people on some other things that we can put together, you know, not in my official role, but, you know, in my other role, I also do food drives monthly, right? That's something I was doing outside of just being a state rep. So I am trying to connect with some people. And I also have Representative Madison in here talk about, he's in District 10, about some of the work we want to do as well together and some of the stuff he already had on the forefront. Connecting.
Get your headset on. Is it a headset over there?
That's what I said. I don't see. Can we take this?
Yeah, y'all can unplug that one and get them headsets on.
Yeah, so I am.
We got to hear what he got to say. What needs to take place because I got folks, you know, hitting me up, Tory. You know, matter of fact, it was already an eviction situation, an eviction crisis going on in the city, but we ain't gonna talk about that. But now you take
local,
the SNAP benefits, and now you don't get the food services, and a lot of people got 4 to 5 kids that they got to take care of on a day-to-day basis that assists and helps with, and when they don't get that,
it's rough, right? And I even talked about like talking to some chefs, and I've been talking to some people that cook. And my mother was like, I'm down. Like, we're going to create lives where people can go on utilizing what's in your kitchen. I also want to create
cook from scratch.
Cook from scratch. Or use what you have, you know, because a lot of people don't cook from scratch, so I'm not going to.
Hold on, it's a little too late to find out how to cook from scratch.
That's
now,
what I'm telling you.
You can't be burning up the food now. You can't overheat the food.
Some beans, some potatoes. Right, no, it's true. But also a way that they can utilize what they have, or a bartering system. Somebody else may have greens down the street, and maybe you got the beans and the flour. So we all have to go back to that system, because at the end of the day, we've always been able to help each other. And one thing we go do is feed you, right? I can remember being at my grandmama's house, whether it was 10 people or 70 people, whatever meal was cooked, fed us all, right? And it wasn't like the steak and potatoes we have nowadays when we're in our refrigerator. It was that good home cooking, right, that filled you up and it lasted. And so we have to get back to some of that. And I know people will say, how does that go happen? But I think it's a community coming together to say we have to make it happen. Like, it hit me too. Like, I don't receive it, but I'm going to be honest, my youngest daughter do, right? She's a young single parent. She have a few babies, right? And she work, right? So it's not like she's not working. She work a full-time job, but obviously she doesn't even make enough to be self-sufficient. So the SNAP helps her. She's one of the people that received the letter too. And
the thing is, it's the kids.
Yeah.
I mean, that are thousands and thousands of children.
It is a lot.
And I tell people, SNAP benefits was actually made for white women. Mm-hmm. Okay, and a lot of folks don't want to hear that.
They be mad,
but that's the truth. Like
ain't black people. On SNAP.
It's just not black people on SNAP benefits. Matter of fact, they made the system because men was going off to war, and they had a system in place so white women can have food options.
They have some assistance to be able to feed their children.
And then we kind of got on the system, so it's more white people on food assistance than blacks.
That is true.
That's true.
Yeah. And so let's not make black face of this.
Yeah.
It's just that our community uses it, and many times when you have representatives that, you know, represent the community that they look like, you have to speak up on their behalf.
Yes, absolutely.
And I want to uplift the fact that you pair the fact that folks are navigating, you know, the SNAP benefits going away this month, next month, and you pair that with the fact
next week.
This weekend.
Talk straight.
You pair that with the fact that you also look at the federal title funding that's going away with our schools, and you will see that our schools will be struggling with lunch programs over this next year.
Yes.
Over this next year. So not only are families going to be struggling with feeding kids at home, our school districts are going to be struggling with feeding kids in the classroom.
Yes.
And that's going to create a whole nother issue.
Yeah, because if I'm on a hungry stomach, I don't care what you're talking about. I'm not finna learn reading, math. I'm not finna sit in my seat. Right. So now you have another environment that is not conducive to learning because you can't learn on an empty stomach. Right. And that's as adults.
That's tough.
Come on.
Yeah. Well, I had kids say that the MPS lunch ain't the lunch that we used to have.
It's not.
But they, whatever they do have, they need it.
They eat it.
Right.
Because they need it, right? Or some of them parents that maybe because of SNAP, you were able to send a sandwich and some chips because maybe your child couldn't eat the
bag
lunch. Yeah, a bag lunch, but that's going to stop too. So we can't talk about a system in place or a state and call our motto moving forward where the only thing we're doing is moving backwards when we're going to hurt families and children. That's then going to hurt the community because to be honest, I think about it all round robin, right? People want to eat by any means necessary. You can't take food out of their mouth without something else that put into place. And like I said before, they want to say, oh, maybe these people are working. Yeah. But once again, they're not getting the amount that they need to get paid to be self-sufficient. Mm-hmm. That's how you are able to get the benefits. It's not people that's making all of this money or middle, and there's not even a middle level income. That I'm gonna just say that.
Middle class is almost evaporated.
You're either have money, you don't. That's where we at now.
Have and have nots.
The have and have nots.
Tell it, girl.
Yeah, these are individuals that are working 2 or 3 jobs that are literally still able to get SNAP and they need it.
Well, they saying people don't want to go to Cheesecake Factory on the first date, so.
Well, these ain't people that's getting SNAP,
I'm
right?
just messing with you.
I know.
I'm just messing with you. Like, I was just reading this dating list, and I'm like, now November 1st for to come.
Well, I mean, I'm pretty sure Cheesecake Factory wasn't taking Quest anyway. So
right.
Let's just make that clear before somebody come on.
No, they
I know you being.
I was just being funny because.
But you know how somebody will take this message and say.
Well, that means that's mental health issues.
It is.
I'm not responsible for cognitive delays. Yeah.
But what we do know is we need to create this system in our community. And I know at the state level, a lot of people may look and say, why aren't y'all doing something? Because this is a federal issue, right?
Right.
Like we got letters going on. We're reaching out to people. We're putting out numbers, but we don't have any authority over the federal part
the federal
of this.
program.
Yeah, and so a lot of times people may not understand it, and that's why as your state reps, we're here to help you with that. Mm-hmm. We can't go in there and say, put this back on, right? We have asked the governor, right, is there some other things that we can do to maneuver and put some stuff out to get it?
What about the surplus?
Let me explain on the surplus.
Because everybody keeps saying that we got like they say $7 billion surplus or something like that?
Yes, people talk about a $7 billion surplus or $4.6 billion surplus. You talk about a surplus that was built off austerity, right?
Right.
You can't say that, where's the surplus when municipalities weren't getting the money that they needed, when schools weren't getting the money that they needed, and we already did not effectively fund critical essential programs around the state. So when we talk about the surplus and what we're losing federally, that surplus does not begin to fill the gaps that we're losing in federal funding. We're losing over $37 billion in federal funding. That's
here in the state of Wisconsin.
In the state of Wisconsin. Right. So $4.5 billion isn't going to fill that gap.
No.
So when we say that we can't do anything as a state to fix this, that's true. Like often politicians, politicians will say, oh, we don't have money for that, right? And there's a lot of ways to generate revenue, or like states can take out loans for programs. We do it all the time.
Right.
But when you're talking about a funding gap that is this large, states can't fill that.
Well, I'll say this, this is the time where we talk about being a village.
Yeah, it's going to have to take a village right now.
It takes a village. And we have a lot of people, when we talk about government attachments in our communities, passing it on to generations and generations. Yeah. Many times people need that assistance. Me and my grandma needed that assistance. But as I grew older and we tried to educate ourselves and then move on from a lot of those assistant ideas. But I think that now people are looking back and be like, okay, well, what did we have as storage?
Yes.
Or, they used to teach in the Bible to have the stuff stored up for the family.
Storehouse.
My grandma my grandma used to always preserve stuff.
Yeah, I got some preserves now for my auntie down south.
You know what I mean? The old school people from South, they used to do the preserving.
Yeah.
We need it.
Putting the cabbage in the freezer and all the deep freezers for the rainy day.
Yes.
But we don't teach those skills no more to preserve.
We kind of become a community, too, of kind of get it now, right? The microwave. And this isn't a slight, because I ain't a person that likes to cook every day, but I found myself cooking more now with everything that's going on. But when you say back to that Billy shoe, when you think about it, a lot of people don't even have deep freezers anymore.
Yeah. They don't even get the deep freezer, right?
Yeah, the fridge. And I was just at my sister's house yesterday, and she was saying how to, trying to keep stuff together. I was like, go get a deep freezer, right?
Gotta have a deep freezer.
I'm trying to tell people now, because we're going to need to preserve and freeze some of that stuff so you can have it for later.
Right.
You know how people be like, I don't eat this, I don't eat this, I don't eat beans, right? You gonna have to figure out what can you keep in your house that's sustainable so that you guys can have something there, whether it's canned goods, right? Whether it's rice, flour. And that's why it's going to be so important right now that we figure out a way to help and communicate and connect with each other. So this isn't just about Tory, you know what I'm saying? And not saying it is. This isn't just about Sequanna or Darrin, right? This is about all of us coming together and say, how do we supply the need for our community? Because we are who we've been waiting for. There's nobody in no white horse that's going to come and save us. It's us. It's us.
It's always been us.
You got this show on repeat. Because I tell people every day, if we don't get out there and do it, how it's going to get done? And I say, you ain't on the right track is when you asking somebody outside yourself.
Yes.
When you start asking somebody outside yourself, you asking the wrong person. And I think that many times when we out in the community, we see those that have accepted the challenge.
Yes.
And salute to all my brothers and sisters on the front lines that have accepted that challenge.
Every day, all day.
But we as a community as a whole have to accept that challenge because when you talk about, okay, somebody's finna cut this off, how are we going to manage?
Yes.
We've already put ourselves in the wrong space to be in because even my grandmama said, don't, make sure you got your own now.
Yeah.
Because if somebody can cut you off, you ain't going to have nothing.
Yeah.
That's right.
My oldest son always had this saying, and he was young. He was like, you never bite the hand that feeds you, but you always watch the one that's cooking. Right? And he was like 5 or 4, and I'm like, where you get that from? But as I've grown, I see he say it's okay because sometimes we all need a handout, but don't take your eye off of what you're supposed to be doing either, right? And so we at a time now where, I hate to say it, right? We at a time where our back is up against the wall, and now we're thinking about stuff to do. So we become people that are reactive versus proactive, right? And so now maybe we should be in the term of how do we become now proactive, knowing that this hit us with SNAP, but what else is coming? Because we know if they don't go back in December 31st, we're talking about healthcare.
Well, we're talking about healthcare right now.
But I'm saying as of December 31st, the amount of people that won't have it, right? I know some people are cut off now. The hospital's going to be inundated with emergency rooms because you can't see your regular doctor without having insurance, but you could go there.
Correct. So I was just at a healthcare roundtable this morning with the governor at Martin Luther King Library, right? And we had folks from DHS, we had restaurateurs, we had childcare folks, we had healthcare professionals, right? Talking about the cost of healthcare. And the governor just made a post, right? And put out a letter explaining how much folks, how much their premiums will be going up. And for a lot of those folks, it's 100%.
Yes.
Some, it's over 180%, right?
Yes.
Folks are paying thousands of dollars in healthcare premiums. And what that means is folks are going to, right? Folks are already struggling with changing their healthcare plans and losing healthcare access due to the ACA changes, right? But that means that hospitals are going to close.
Yes.
Right? And we've seen that in rural Wisconsin, right?
Yes.
Clare closed, Western Wisconsin closed all of their hospitals. Folks are literally having to get flown.
Yes.
No, flown to hospitals
when
they're
in Eau Claire?
In Eau Claire?
Yeah, in Claire.
In
they closed it. Western, they closed their hospitals.
And so on. And we were trying to figure out that gap, but we're about to be presented with a bigger one. We're about to lose more hospitals in urban communities and more in rural communities. And we're about to undergo a healthcare crisis if this federal government does not figure out an alternative to the ACA.
Right.
Folks have plenty of feelings about it.
Yeah.
Right? And it's okay to say, all right, the ACA is not it.
Right.
Because it's not a perfect piece of legislation.
Right. But what happens when there's nothing even like the ACA?
You don't have an alternative.
Yeah.
If you don't have an alternative, folks will be dying.
Yes.
Well, we got to run a break, but when we come back, I want to shift gears here to the Milwaukee County's First Step Detox Center.
Okay.
They talking about this detox center too, going. It's supposed to be something at the dorms tonight with that. Do y'all know about that?
But it's for the county, not the state, though.
Okay, so you don't have anything to do with the county.
And this preview is state because I came on as a state, but I'm still on the county too.
I see you. You know, I know you get down on all levels.
Okay.
You got a lot of hats you be wearing.
I do. I have several hats.
But we'll continue the conversation with the snap. But I want to touch on that because that is something that people want to kind of get a good idea about too.
Okay.
Hey, look, Truth Nation, when we come back, we got Sequanna Taylor, Assembly District 11 in studio. Stay locked in right here on Tory Lowe. 101.7 The Truth, Tory Lowe Show. We got guests. We got Rep Sequanna Taylor, 11th Assembly District, and we got Rep Darrin Madison, 10th Assembly District, 11th and the 10th in the studio. Hey, look, we got a couple things I want to discuss, but first off, there's something going on with a detox center.
Yes.
They're supposed to be having something tonight, or some kind of. They've been protesting to have a hearing on this because they're thinking that without this detox center, it may get bad out here for those that need the rehabilitation.
So right now, and I serve at the state, and Sequanna overlaps at the county and the state.
Yes.
In the county budget process, the detox center did not get the resources that it needs to stay open, and that's because the county is under a tight strap budget, right? And
$43 million.
Yeah.
Oh wow.
So that's putting the county in a bad spot, right? Act 12, which gave counties and municipalities more revenue, wasn't enough.
No.
And so that means that the county has to, again, make tough choices, right? About our buses, about our detox centers, about everything.
Right.
But people are saying that they need that detox center.
Right.
It's a life-saving measure, right?
Life.
I've had a few years ago, my uncle passed away after getting out of prison because he ended up overdosing because he was not able to get access to a space that could have made the difference, right? Yeah. So folks are protesting because they want that space open because they know that space will save lives.
Save lives.
Okay.
Yeah. And I know I'm here on the state, but just to let people know, the county does have a public budget hearing tonight at 6 p.m. at the Milwaukee Domes.
Okay.
Doors open at 5. So if people want to come and talk about things on the county level, I implore you to come to that budget hearing because, once again, there are some people that look like me, but a lot of times people that look like me or come from our communities do not come out to the public budget meeting. It will be all 18 supervisors. We are not talking, we are just listening to what the community wants and the priorities. And so usually after that meeting, people can go back and do some type of amendments for the budget. I just want people to know too that in this budget, when we were given, and there was no extra money. So any amendment you make out of this budget, you're going to cut something else. So I want people to understand that's how the budget works. There is no money hidden anywhere. And even at the county, too, I've been putting it on Facebook. I know I'm here for the state. There are going to be at least 10 bus routes that are eliminated and more that are modified because we do not have the funding federally or from the state to sustain these buses. And they are very vital to people who utilize them every day for work, for school, for doctor's appointments, for going to the store. And so once again, I implore you to either send it in or see who's your rep. If you contact my office on that side, not the state side, I can help you know who's your supervisor. But if you can't come out to that meeting tonight, I think we'll even be live. It'll be very important so you know what's going on within the county.
Where's that meeting at?
At the Domes. Once again, it's at 6 p.m. Doors open at 5 p.m. You don't have to sign up to come. You just come. If you want to speak, you can sign up to speak. If you don't want to speak, you can just come to hear it as well, too. So that is something very important. That budget has to be passed by November. Just into some legal qualifications. And so that means after this budget meeting, we go back into amendments for 2 more days. And after that, we have to pass a budget regardless of what it looks like.
Right. So let your voice be heard.
Please, please.
Get outside. Let your voice be heard. Somebody said that in the chat, they're saying that the detox center, don't Vin Baker have a the same detox center. How's that facility working out? I don't know. I don't know what's going on.
Yeah.
The Van Baker one.
Yeah, I remember. I don't know how that facility is doing. I know it opened last year.
Is that the one at Serenity?
I thought this was downtown somewhere.
No, the Van Baker Center is on. It's in your your neck of the woods.
Yeah, it's not down. Yeah, you're talking about something.
But it was created by by folks. To be able to be an access point. For folks to be able to detox. And I don't know, they haven't released any data on how successful they've been over the past year, but that doesn't mean that the one that folks are protesting.
The one is more public facing.
Yeah.
I would say that one. And that one may have different criteria and qualifications, but the one that they're protesting now is more of a public one. People have access and utilize it, and so we want dollars to go into that one. The other one, if I'm believing the one that the groundbreaking on, not saying it's not for the public, but it's more of a private entity versus when we're talking about a public government entity, right? And so
that they need.
Yeah, they're governed by different roles and stuff that they can do, or the access to people that they utilize or see.
True. And a private entity can deny care, right? At the end of the day.
Yeah.
And I want to go into another conversation that's been a hot topic, cannabis.
Yeah.
Cannabis in the state of Wisconsin. A lot of people, I guess they say cannabis, but we say weed, right? I mean, is it the weed or is it cannabis?
So
they've been trying to legalize the weed. I mean, I'm just going to say the weed, but it's cannabis, I guess. It's all cannabis, right?
Yeah.
So my office.
Darrin is working on some policy now.
Yeah. So my office, since I was sworn in last session, has been leading on cannabis legalization in the state of Wisconsin, and doing that in a way that both makes it legal both medically and recreationally, while also giving expungement to folks who have been incarcerated.
Because if we go do that, we need to go back and change some records.
Yeah, and then what a lot of states have also done is created a access point for what we refer, the creative term we say is legacy entrepreneurs.
Yes.
But as we know, folks who deal in the streets, right?
Right.
Folks who were in the industry illegally, who were incarcerated.
Street pharmacists.
Yeah, straight up. They should be able to access this industry first, because we know how much the incarceration as it relates to cannabis has harmed our communities.
Right.
And if there's going to be a profit that's generated from
Let's
cannabis
not leave
sales,
community of colors out.
Yeah.
I agree.
No state.
Because many times we get it after it's been stepped on.
Yeah.
So California actually made all their people create a committee for communities of color. And they're leading in some stuff with cannabis, and I'll let Madison talk about it more because it's his thing. But they made them create this task force to ensure that communities of color were not left out of it and can do the profits, because we also know if it does become legal, we know that they can put in different criterias or restrictions that oftentimes will hurt us.
Requirements that you can't meet.
That other people are able to benefit largely from this, and the communities of colors are still like...
You got to have a master's degree.
Well,
not even something legally. I'm just saying it could be something like your background,
So check it.
Yeah.
You can't be a felon or something.
No state has done this right.
No.
Like California has done some really good things, but it has not done it right.
It's not perfect,
Chicago has not done it right. Colorado has not done it right. Michigan, Minnesota, right?
Yeah.
None of them have done the expungement piece and giving folks access to the model right. Because one, the licensing.
Yeah.
Right. When it costs you $30,000 to $50,000 to get a distribution license.
Yeah.
When it costs you $100,000, right, to set up a facility, the way that
that ain't even getting the product.
Right.
No.
That's not even getting the product.
So we know who is geared to.
So when the barrier to entry is $1 million.
Yeah.
Right. To be able to sell, to grow, to process cannabis or marijuana or weed, right? We know we use all these different terms to describe it. It never hits our community.
No.
Because we don't have them. When this industry will come into place, we won't have $1 million in our pockets to drop in. But
it's like trying to get a house.
Yeah. You know who will?
Them corporations.
Precisely. Yes. And they will saturate the field at ASAP.
And they'll make it like, I won't say a different company, but they'll make it like a company we have now that's the only person you really can buy from, right? Yeah. Like the only person you really
they monopolize.
They'll monopolize it, and we know that's something that we need to be on the forefront of and not be reactive when it happened and say only if we could have. So I'm so thankful for Representative Madison for all the work he's doing with this.
That's powerful.
So real quick, in our bill that we'll be introducing in the coming weeks, because Republicans are trying to legalize cannabis too, medically, and they're trying to create the most restrictive medical cannabis program in the country. That's their goal, right?
Yes.
Our bill creates those real access points so that folks can make the medical choice that they want to, but two, access recreational cannabis, understanding that folks are lacing cannabis, right, and leading to people's deaths.
Right.
The best way to navigate laced products is a regulated market.
Yes.
Right? If folks can know that the product that they're using is safe, tested, and coming from a trusted business, you're saving lives.
Yeah.
You're saving lives. So that's what our legislation's doing. It'll generate revenue. It'll help us fill some of the bigger federal gaps that
and
we're
it'll bring in more money.
Yeah,
for the state and the city and the local government.
When we talk about deficits, right? Here's a way for us to allow money to be reallocated to places that need it, right? Mm-hmm. So when we're talking about SNAP and Medicaid and housing, right, and they're saying where are we going to get money from? Because to be honest, we're at the point where it's either increasing the sales tax or wheel tax, and we don't even want it, right? Like, I don't even want it, but when we think about other ways of revenue, at this point now, those are the only two ways we can increase revenue, is a sales tax and a wheel tax.
But you're draining it, No,
I'm not saying I want to do it, but
what I'm saying is Milwaukee has 40% blacks.
Yes.
And we got the most taxes out of all the areas in the state of Wisconsin.
Yes.
Matter of fact, they got benefits and we got tax. So what's going on here? Like, it's discriminatory practices going on.
We need to figure out other ways that we can bring in revenue, and cannabis is one of those, right? True. And we're open to hearing about other things that we can do, but we know that can be a proven factor to say this is going to bring millions, because guess what? Our neighbors, Minnesota is getting it, Michigan is getting it, Chicago is getting it, right? They're even probably getting the revenues from Wisconsinites. In our
last physical estimate from the Legislative Reference Bureau for our bill, it was $138 million in its first year.
Yes.
And that's when, if we had passed the bill that we had introduced last session in October, we would have had $180 million by the end of the year.
Yes.
So in 3 months, October, November, December, we'd have garnered $180 million. Imagine an entire year of cannabis sales in the state of Wisconsin.
That's 3 months, like a quarter.
That would generate a substantial amount of revenue that municipalities can benefit from, counties can benefit from, the state can benefit from, and we can talk about how we meet critical needs. Right? We have a housing stock gap.
Yes.
Right? Over 300,000 homes need to be built in Wisconsin so that folks have access to housing right now.
Right now.
And we say, where do we get the money from that? Right there.
Yeah.
Well, it's sounding powerful. I hope that it all goes through. Milwaukee need to have first dibs on whatever they do with the weed, because we got mass incarceration going on. We need parties.
What I said. We finna do
we
it.
need a lot of those things.
I'm all for it. And this family don't even smoke it, but I understand the benefit.
Start here. I don't even smoke it.
No, I'm saying I understand the benefit.
And I do understand the benefit,
like,
right?
Hey, why you want that? I understand.
Well,
I'm with you on that.
We need it.
The good thing is you got somebody from Milwaukee leading the conversation.
Yes.
Well, that's powerful.
If I got anything to say about it, that means we will get something that we deserve. Because at the end of the day, in that building, Milwaukee is constantly left behind.
All the time.
And we're often, as legislators and folks from Milwaukee, we're often left out of the conversation, even as elected officials.
They build walls quick when you say Milwaukee.
Man. But we got a seat at the table for that.
Yeah. Well, look, we got to run a break. I'm going to get y'all final thoughts when we get back.
Absolutely.
What y'all feel like the community need to know, and how can we keep up with y'all and y'all causes?
Absolutely.
Once again, we got Rep. Taylor, 11th Assembly District, and we got Rep. Madison, 10th Assembly District, right here in the studio. Stay locked in right here on Tory Lowe. 7 The Truth. Tory Lowe Show. Once again, salute to my guests in studio. We got Rep. Taylor, 11th Assembly District, and Rep. Madison, 10th Assembly District in studio.
Yeah.
Sequanna, Darrin, I want to get y'all final thoughts. How can people keep up with what y'all doing, and what do y'all want the community to know?
Absolutely. So I have a Facebook page. I think I have some other social media. My office handles it, but it's Representative Sequanna Taylor. If you put Sequanna Taylor Rep or Sequanna Taylor, Google, it'll bring up my website, my phone number, and my email address. But I can give the phone number 608-237-9311. Please, if you call our office, we'll ask if you want to be on our newsletter update. I send it out monthly about what's going on and some of the events that I have. What I want to leave you with is also we are part of the Wisconsin Black Legislative Caucus. I'm the vice chair. Senator Dora Drake is the chair. We have been visiting around the state of Wisconsin. I'm talking to individuals about what does a black legislative agenda look like in leadership. Right, and we'll be in Beloit this Thursday. We've been to 4 other places. 3 more have called us, so we're trying to see how to make it happen. We also have an event November 8th. It's a leadership summit where we're doing different workshops, giving out information, but we're just not doing the workshops to do them. Out of these workshops, we're trying to produce policies that create changes, right, with the community at the forefront and us helping with the advocacy and legislation part of that. The other thing is this October is Domestic Violence Awareness Month. As a survivor, I want you guys to make sure you tap into events that's happening. DV does not just happen in the month of October. It is not a black issue. It's not a social economic issue. It is not a zip code issue. It's 1 in every 4 women, and stats are 1 in 8 or 1 in 10 men. Men can also be victims of domestic violence. Children are not just witnesses. They are also victims, because if a child ever had to live in a household with that, please, while you're getting your self-help and assistance, make sure we're helping them children as well, too. I have an event at the Capitol. It is October 30th from 10 a.m. to 1 p.m. This is the first Domestic Violence Legislative Advocacy Day. Please contact my office if you want to be a part or find out more what we're doing. We are also pushing the Purple Alert. If Wisconsin passes this, we'll be the first state. The Purple Alert is similar to the Silver and the Green, but it is for domestic violence survivors who have gone missing. We are also trying to incorporate something in place for a person that has escaped, do not need to be found. So we are working on that legislative piece. But Wisconsin, we can lead this, right? I got this resolution, and it's an amendment from a mother who lost her daughter. And when they did the autopsy, they found out the time frame was during the same time frame she was trying to get a missing persons report. And because the daughter was an adult, we have a wait period that is through the state of Wisconsin, right? So please, let's make sure that we stop DV, right? Like if you know someone that's going through it, let's be a helping hand. I can send information to you about some of the other work I worked on with DV. I believe my story can help. If it helps save one life, then I've did my due diligence of telling my story. So thank you for this opportunity. There's a lot of work more that we're doing. We'll love to come back and bring other members of the Black Caucus and just tell you what that work looks like as well.
Oh, I welcome that.
Thank you.
We got to make sure we have the conversations with everybody.
Yes.
That's working on our behalf.
Absolutely.
For sure.
Thank you.
Very similar, right? I can be found on all social media. Just look up Darrin Madison. Either Google me or find me on social media, or find me on all social media platforms. And I'm super accessible.
Yeah.
I also have coffee hours at Kumba Juice in the River West, in the Harambe neighborhood. In Shorewood, I have it at Collectivo. And then in Glendale, I have it at Stone Creek Coffee, and it rotates every 3 weeks on Saturdays from 10 a.m. to 12 p.m. So come talk to me about policy whenever. I'm also working on a 2% fixed energy bill rate for all all people. Right. Yeah. Right now, the Public Service Commission is raising energy prices.
Oh, it's so high.
And every time We Energy says we want a little bit more money, the Public
Everybody
Service
wants a little bit more money now.
Says yes. And who pays the most? We do.
Right.
Businesses get a better energy rate than people in this state. So a fixed 2% energy rate is something we'll be introducing in November alongside cannabis legalization. So follow the policy, show up, hit up your legislators so we can make some stuff shake.
And what have we not discussed that you want the community to know about moving forward with the Black community? What do we need to know?
For one, pardons and expungement, we know this governor is leaving in less than 2 years. The pardon process is 18 months already. So if you are eligible for a pardon or you think you are, please get your information and paperwork in. We don't know what it means for the next governor. Hopefully they want to keep it going. But if not, we didn't have a pardon board for almost a decade. Right. And there's thousands of individuals right now with the pardon board. We talked about housing. We know there's a housing crisis. All of us are having conversations on housing and what does that look like. Cannabis can help us with the 300,000 houses that we need, right? We talked about that as well, too. We talked about SNAP, Medicaid. Child care is another one. I know we don't have time, but child care is so critical within our communities, right? And so we need to hit on child care as well, too. I know it's probably a plethora of other informations, but I know those are the constant 5 things we hear regardless of where we go throughout this state.
And real quick, right now, like Sequanna said, the government won't save you.
No.
We need to be, especially as a community, building systems of mutual aid.
Yes.
Mutual aid has helped us throughout every major struggle that our people has navigated. So we need to be as neighbors, as community members, saying what systems we need to set up. Hey, we got kids who need childcare. Who works from home?
Yes.
We got folks who need food because, like I said earlier, school meal programs will not have the money to continue to sustain giving kids school meals starting next week too.
Yeah.
Oh wow!
Right. So that means that parents and neighborhoods we need to feed the kids.
Yes.
And then 3, we need to make sure that we are looking at how we support each other when folks are navigating transportation issues as buses go away.
Yes.
In our housing,
many bus routes are getting cut.
Right. In our foregoing housing crisis. Right. This is year 1 of a presidency and that has a long path to continue to be taking resources out of communities. That means that we need to be coming together stronger to do what we need to do to take care of each other.
Well, thank y'all for coming in. I appreciate you. Everything y'all trying to do, Rep. Sequanna Taylor, Rep. Madison. I appreciate you. 10th and 11th District in studio today. And come back. I want to talk about more of the things that are going on in the community as well.
Yes.
And we got to make sure that we keep people up to date on what we need to do moving forward.
Absolutely. Thank you for that. We'll be back. Thank you guys for this opportunity. Remember tonight, if you can come to that county public budget meeting at the Domes at 6 p.m. Doors open at 5.